Hey everyone, Dr. Gage here with our follow-up video to the previous video. Now this is related to golfers and common golf injuries. So in the previous video, we talked about the importance of assessing not just the site of pain, but the entire kinetic chain that is involved in the golf swing. And now in this video here, we're going to talk about some of the most common injuries we see in the upper extremity here related to the golf swing and how we can help here at HealthFit. So starting with the shoulder here, this is a model of the shoulder. This is the right shoulder with the collarbone here. And you can see we have muscles on the inside of the shoulder, on the back side of the shoulder. We have various ligaments surrounding the shoulder. And with the shoulder, it's a very mobile joint, which is great for the golf swing, right? We need that mobility to move our arms throughout the swing and to transfer force. But sometimes we also need some stability in the joint there. So here at HealthFit, when we're dealing with a common golf injury such as a rotator cuff strain or an overuse injury of the shoulder there, we need to assess, is this a mobility issue or is this a stability issue? And then we'll go ahead and treat it properly according to our findings there. So we like to do an extensive amount of rehab with that, tailoring to whether we need stability or mobility. Another one of our favorite techniques here in office is active release technique. So we'll use that for soft tissue techniques. And then of course our shockwave therapy to help bring down that pain and inflammation in the area. Going into the elbow here, really common golfer's injury is that golfer's elbow here. Now that's on the inner portion of the elbow here. So when we do forearm flexion, a lot of those flexors of the forearm here connect up onto the inside of the elbow here. And so with that, what happens is we get an overuse of those tendons when they come and attach to the bony site here. And that can be known as medial epicondylitis or golfer's elbow. Very similar to soft tissue techniques we've used for the shoulder. Active release technique works phenomenal for that. And then one of our newest go-tos is shockwave therapy here. If we can bring down the inflammation on a biochemical level of the tendons in the elbow there, we can really get back to the course and back to swinging pretty quickly there. So finishing out the upper extremity, we often see a lot of wrist pain and wrist sprains at the wrist here. That usually comes because maybe we didn't hit the best shot and we kind of hit the shot fat or hit the ground early there. It can put a lot of pressure through the wrist at the end of that force that travels through the upper extremity out to the wrist and out to the club when we hit the ball there. And so with a wrist sprain, there's kind of two phases of care. First, we need to bring down some inflammation in the area. We'll use shockwave therapy or our class 4 laser in here. That'll also help bring down some inflammation. And then we need to work on making sure that injury doesn't happen again and promoting some stability of the ligaments in that area, healing those tendons and taking care of any soft tissue or joint restrictions that may have developed in that area as well. So this is another video that explains why we need to assess the whole kinetic chain with our golfing population here. In the next video, we're going to talk about all things lower extremity. So stay tuned for that one. I'll see you guys then.